All right, good morning, everyone. I've said good morning a number of times, but this is the official good morning because we're going to get started with our program. We're so glad that you're here today. So welcome to your orientation to the School of Public Health. My name is Jenny Porter. I'm the Assistant Dean for the Enrolled Student Experience here at the University of Minnesota, and I use she, her pronouns. My role in SPH is to support all of you, no matter what program you're enrolled in, through your entire SPH experience. From today here at orientation all the way through to your commencement. My background is in higher education administration, and I have over 20 years of experience supporting students through the start of their collegiate experience. Beginning your degree, or continuing one for those of you going on to PhDs, is a major milestone, and I'm honored to be here to support you in your journey. If you've engaged with the online orientation course in Canvas, you may have explored a number of resources that allowed you to identify the indigenous territories, treaties, and languages in which your home and the University of Minnesota are located. As we start today, I would like to take a moment to acknowledge that the U of M is located on ancestral and traditional contemporary lands of the indigenous people. Minnesota comes from the Dakota name for this region, Minnesota-Makoche, the land where the water meets the skies, reflect the skies. We acknowledge the ongoing debt that is owed to the Dakota people and strive to create a healthy dialogue, relationships, and practices that address this injustice, as well as others related to the indigenous people of this state. We highlight this fact because we recognize that our physical, virtual, and emotional space that we inhabit impacts how we do our work, and because the mission of public health naturally aligns with anti-oppression work. As we prepare to kick off the start of the fall semester, we're excited to welcome you to the engagement opportunities that will support you in your transition and help prepare you to make the most of your School of Public Health experience. Right now, we're hosting some of you in person and simultaneously hosting some of you in our online webinar that's being recorded. We encourage you to engage in many opportunities over the next few days and into the fall semester. And no matter how you show up, please know that your excitement and your trepidation is welcome. We welcome you in your roles as students, as parents, and caretakers, change agents, and educators. Your individual quirks and ambiguities are welcome. We welcome you at whatever level of mental and physical wellness you're currently functioning. We welcome your humor, and we welcome your silent contemplation. We welcome the parts of yourself you're still figuring out. We welcome your awkwardness, and we welcome your curiosity and questions. All ways of knowing, learning, and lived experience, and the many gifts you have to offer are welcome here. I know many of you are eager to meet each other, and you've been doing a great job of that this morning, to build connections. So I'll take just a few more minutes to introduce yourself at your table, or if you're online, you can introduce yourselves in the chat, and one word that describes how you're feeling right now. So I'll give you about 2 minutes to do that.
I got your slides rolling. Yep. Do you want to do it yourself, or do you want me to? I'm following you. I got you, girl. And I came up here to talk to you, so you didn't look like you're standing here by yourself.
Oh, yeah, please. And then there's a note that
You got it.
Okay. I totally forgot.
Did you think you were doing it yourself?
No. All right, I hope that you continue to make connections throughout the course of the day and share how things are going. I know that a lot of you are managing lots of different things right now with moves and getting settled for the semester, so we're excited that you're here, and I hope you continue to make connections with each other. I know many of you spent some time in online orientation, and I hope that resource has provided a high-level overview of all that's available to you as you begin your program. Online orientation will continue to be accessible to you throughout your entirety here at SPH, so don't be afraid to refer back to those slides and modules as you have questions and things come up in the semester. So our goal today is to provide a face to the many people who facilitate and provide the services that you learned about through our online orientation. We also want you to begin to identify ways in which you want to be involved in creating your SPH experience. So throughout today, you'll hear from a variety of university students and staff and faculty who are here to provide you with the tools that you need to be successful in your degree program. Most of you will also have an academic level program orientation this afternoon where you'll learn about academic expectations, meet fellow classmates, and faculty in your program. Once again, I highly encourage you to engage in all the orientation programming available to you and the many opportunities that will take place between now and the start of the semester. So here's our agenda for this morning. We're going to welcome Dean Melinda Pettigrew, Associate Dean Betsy Wattenberg, and Associate Director Gail Smaller Jr. here to welcome you to the University of Minnesota and to the School of Public Health. We'll then break into some smaller sessions so you can learn more about your public health career and hear from some current students who can give you some insights into what it's like to be an SPH student. We'll be wrapping up our morning with lunch, and you'll be able to go on your way to your academic program orientation this afternoon. So now I would like to introduce our Dean, Melinda Pettigrew. Melinda Pettigrew is Dean and Professor of the University of Minnesota School of Public Health, right? We said that. She also holds the Mayo Chair in Public Health. In this role, she provides collaborative leadership to maintain and advance SPH as a premier leader in public health. Dean Pettigrew's research focuses on the epidemiology of respiratory tract infections, the microbiome, and the One Health threat of antibiotic resistance. She is nationally known for her research and leadership roles in the Antibacterial Resistance Leadership Group, which is an NIH-sponsored initiative whose aim is to combat antimicrobial resistance. Prior to joining SPH, Dean Pettigrew was the Anna M.R. Lauder Professor of Epidemiology at the Yale School of Public Health, where she held several leadership positions, including the interim dean. We're so excited to have her here. She's about to come on stage, so let's give a big round of applause for Dean Melinda Pettigrew.
Thank you for the introduction, Jenny, and thank you to our newest School of Public Health students. There is a lot of energy in this room, and I'd like to start just by asking you all to give yourselves a round of applause. You are here. Your public health journey starts now. It's really exciting. So it is my absolute pleasure to introduce you and welcome you to the new 2024 New Student Orientation. Choosing to pursue a career in public health is a big decision. And if you're like me, you had a light bulb moment. My light bulb moment took place in college. I heard this speaker from Johns Hopkins talk about the HIV epidemic. I was a biology major. It was the first time I really saw how the mechanistic stuff, the science, integrated with what I hoped to do, which was to change the world. I learned about how the HIV pandemic was impacting communities. I learned about economics, and public health is an interdisciplinary, integrated science. And it's really, really, really exciting. So if you're like me, you had your light bulb moment. You may not know exactly what you want to do, but I'm pretty confident that each and every one of you really is here because you want to impact change and you want to help the communities that you're interested in serving. Thank you for choosing the University of Minnesota School of Public Health. This is going to be the place that you've chosen to continue your education and pursue your calling. You are joining a university and a state that has been a national leader in public health since the beginning. The teaching of public health in U.S. universities across the United States began right here on this campus 150 years ago, when Civil War surgeon Dr. Charles Hewitt taught the first public health course in 1872. The university later founded a school in 1994, and this means that this year we're celebrating our 80th anniversary, which is really exciting. And I'm thrilled to be your new dean. I don't know if it was mentioned, but this is my 7th month on the job. Our school has contributed many firsts, major accomplishments in field-changing studies to public health over the years. We conducted the first multi-country epidemiologic study that served as the foundation for the Mediterranean diet. Our biostatisticians are NIH funded, and they work on vaccines and clinical trials associated with the Ebola epidemic in 2014 and the recent COVID pandemic. Our experts developed a new treatment protocol for individuals who are living with HIV. saving millions of lives as a result. We were the first to make the association between e-cigarettes and cancer-causing agents, and we influenced policy to improve health equity, such as recent legislation that helps increase doula care and access that is funded through Medicaid in the state of Minnesota. This is just a small sample of the fantastic work that is being done here, and it exemplifies and impacts our history, and it's a privilege to be part of such an amazing institution. Now that we've taken a moment to reflect on the past, I'd like to turn forward to the future. The school's long-standing dedication to addressing society's most pressing and complex public health issues, racism, substance abuse, healthy aging, climate change, to name a few, these resonated deeply with me. This work embodies the progressive, determined, and collaborative spirit that defines our community of staff, students, and faculty. UMN School of Public Health is a great school, and my vision is that we are known as the following: a diverse and collaborative community of scholars, practitioners, and learners who work together across silos and function as one school that is nimble, effective, data-driven, and positioned for impact. This is a school that shines as a research institution and is equally admired for its transformative approach to practice, learning, and the student experience. This is an institution where I hope that all of our policies, practices, and governance models are aligned with our mission, values, and commitment to advancing health equity. We will be the top trusted source for public health information, evidence, policy, and actions for the University of Minnesota, the state of Minnesota, and the region. We are committed to moving the needle and improving the health of the communities that we serve. This is a school that is dedicated to service and action. Our school is a vibrant community that offers a wealth of opportunities for you to thrive academically, professionally, and personally. I highly encourage you to be curious. Make the most of your time here at the school and seek out opportunities that will aid you in your overall experience. As you embark on this journey, I want to share a few suggestions. Actively participate in student groups and professional organizations. You will have the opportunity to build connections with your peers, professors, and alumni by joining student groups. These include the Student Senate, the school's official governing body, or participating in our world-class mentoring program. This provides you access to diverse professional experiences and the chance to build enriching and lifelong relationships with alumni. Our location is in a politically progressive state with a thriving community of the nation's top health systems and organizations. We have the Minnesota Department of Health here, the Mayo Clinic, and these will give you abundant opportunities to collaborate to effect positive change. Gaining practical experience is absolutely crucial to public health. Fortunately, this school offers numerous opportunities for hands-on learning through partnerships. These could be with the local health departments, nonprofits, or other organizations. I'm really asking you to leverage the many resources that we have to help you engage in internships, research projects, and make sure these align with your interests and goals. One example of this is the Minnesota Leadership Education in Neurodevelopmental and Related Disabilities program, which provides interdisciplinary training and practical experience in addressing neurodevelopmental disabilities. We are fortunate to have collaborative working relationships with our other health sciences schools. There are only 4 universities across the country that have 6 health science schools. Don't hesitate to reach out to the faculty for guidance and mentorship as well. They're here to support you for your academic and professional journey. Your time here will sometimes be challenging. The curriculum will be rigorous, and I'm 100% confident that it will be rewarding. Seek out experiences that will challenge you and help you grow. Remember, the journey is as important as the destination, and that every challenge and even failure is an opportunity to learn. Focus on the specific areas of public health that interest you. These may change. Our faculty are leaders in many areas. These include health equity, aging, maternal health, and more. These can offer you insights and opportunities to deepen your knowledge. To live up to the school's guiding value that health is a human right, we each have a responsibility to expose and dismantle racism influence whenever it is, wherever it is, and this includes our school. Given this expectation, I recommend that you engage with our strategic plan for anti-racism, which you will hear more about later in the presentation from Associate Director of Diversity, Equity, Inclusion, Gail Smaller. As you learn more about the school and interact with each other, my hope is that you feel connected. This really is a community. It's one of the reasons I came here. It's what drew me to this school, and so take advantage of it. I hope that this connection deepens as you continue on your journey and that you're able to make the most of your opportunity. You each bring unique talents and gifts, and we're honored to partner with you on this new adventure. Welcome to the School of Public Health. All right, I now want to introduce you to our next speaker, Betsy Wattenberg. She's the Associate Dean for Education and Student Engagement. She's a professor in the Division of Environmental Health Sciences. Betsy's been involved in public health education for many years, teaching, advising students, and directing the MPH, MS, and doctoral programs. Please help me welcome Betsy Wattenberg.
Wow, it's so great to see all of you. I'm so impressed by this really great, what a great group you are and that you're all here today. So it's really heartening to see all of you here today. Thank you, Dean Pettigrew. Good morning, I'm Betsy Wattenberg, Associate Dean for Education and Student Engagement. And on behalf of the faculty and staff in the School of Public Health, I'm really excited to welcome you here. So as Associate Dean, I oversee all of the education programs in the School of Public Health, and my job is to make sure you get a great education and that you have all the support you need to be successful. So our goal is to provide you with the knowledge, skills, and experiences you need to become leaders in public health practice and research. As Dean Pettigrew mentioned, you'll learn from the experts. So our faculty are leaders in cutting-edge research, and they're also dedicated to serving the community and making the world a better place. You'll also have opportunities to apply what you learn in the classroom to research and to real-world practice experiences. As Dean Pettigrew mentioned, an important part of high-quality education in public health is addressing racism, diversity, equity, and inclusion. We're all very proud of the strategic plan for anti-racism, which you'll hear about soon. As we begin the 4th year of the strategic plan, we should absolutely celebrate what we've accomplished, but also remember there's still a lot of work to do. In the classroom, keep in mind that we're not always aware of each other's personal and professional experiences and how each of us relates directly or indirectly to classroom material and discussions. So be thoughtful about the experiences, biases, and perspectives you bring to the classroom. Likewise, as you begin your coursework here and explore public health data, we're all about evidence-based whatever, do be mindful of the humanity behind the numbers and statistics. Be aware of the complex lived experiences of people in the community who are much more than what's represented by a data point. I want to reiterate what Dean Pettigrew said and encourage you to make the most of your time in the School of Public Health. Engage in your learning, ask questions, let curiosity drive your exploration, take advantage of the opportunities you have to be an active participant in your education. As Dean Pettigrew mentioned, consider participating in the School of Public Health Student Senate, serve on committees in your own programs, make sure to provide feedback on your courses and your practice experiences so we have an idea of how you're experiencing these things and we can make changes and make sure that we're offering what students need. And finally, of course, make connections. So get to know the faculty and your classmates, get to know our alumni through the mentor program, which Dean Pettigrew mentioned, and make sure to attend your program orientation later today. So thanks for choosing the University of Minnesota School of Public Health. Have a great start to the school year. And I'll now turn the mic over to Gail Smaller, Jr., the Associate Director of Diversity, Equity, and Inclusion.
Good morning. So I'm gonna go off script a little bit. I'm a call and response type of individual. I know it's a little early, but it's not that early. So let's try that again. Good morning. It's great. How are y'all? Are y'all taking care of yourselves? Are y'all practicing self-care? Good, good. All right. So my name is Gail Smaller Jr., and I serve as the Associate Director of Diversity, Equity, and Inclusion here at the school, and I use he, him, his pronouns. We are a team of 2 full-time staff members. Lauren Jones in the back serves as our director. Our shared office is currently in Mayo C304. It's like right down the hall from the Student Services office. But we ask that you email us before you stop by. So in July 2021, I'm gonna let them do that because I will mess it up. In July 2021, the school launched the Strategic Plan for Anti-Racism, affectionately called SPAR, which by now you all have heard about, at least from the last 2 speakers. Our school has made a commitment to move towards anti-racism to ensure that we are a school that is welcoming, inclusive, and justice-centered, recognizing the inequity of racism and its impact on all of our SPH community. While we have a lot of work to do, and racism will not end anytime soon, I am proud of the progress we have made as a school and look forward to continuing this work with all of you as part of our SPH community. We continue to think of the various ways that students can get involved in this work without asking you all to carry the weight and burden of helping us create solutions. We invite constant critique, feedback, and questions as we continue exploring innovative ways to welcome you all as students into this work. We recognize that students of color will often carry the weight of navigating racialized conversations, and we ask all students to be more invested and engaged. Do not be afraid to call out microaggressions when you see or experience them. Ask your faculty to explore data and research from a wider range of ideas and identities, and question everything. The Action Alignments team is our school's committee whose members have been charged with overall implementation of the goals within the SPAR. I am proud to say that we currently have students serving on all subcommittees and invite others interested in sharing their voices. Additionally, there is student representation on all divisional DEI and anti-racist practice committees as well, and you all are welcome and invited to be a part if you are so interested. I invite you all to explore our recently published SPAR Progress Report, which is available online as well as probably at the QR codes on the table tents if you are here with us in person. And then reach out with any questions, thoughts, or suggestions you might have. Though you all might have been here only a short while, aka a couple of weeks, I invite you all to partake in our SPH Climate Assessment, which will be released in a couple of weeks. Your responses will help us continue to envision what a welcoming and inclusive climate here at SPH will look like, and we invite you all to partake in follow-up focus groups in which we will compensate you for your time to further expand on your thoughts and experiences. Additionally, you will receive invitations, announcements, and newsletters about opportunities to be involved in more specific ways. One such way you can get involved is to attend our BIPOC American Indian and International Community Welcome on September 24th from 3:30 to 5:30 p.m. This will be an opportunity to connect and network with other BIPOC American Indian and International students, staff, and faculty in our efforts to continue building community. Also, our Justice and Public Health series will feature monthly virtual guest speakers and cover topics of public health that show social justice and anti-racism in action. Topics such as climate justice and health, equity in indigenous communities, food justice and Black radical imagination, the U.S. opioid epidemic and Black experiences, abolition, radical possibility, and liberation in public health. You can stay abreast of our events and opportunities by engaging with the student newsletter, The Sphere, visiting the DEI website, and through our monthly DEI newsletter, Notes on Anti-Racism and Justice. Lastly, we manage listservs for our Black and BIPOC students here within SPH. If you would like to connect with other BIPOC students and stay in the loop, Please complete the form at the Z-link provided on the slide to be added to one or both of the listservs. General questions and feedback can be sent to either myself or Lauren. I believe in our commitment to move towards anti-racism, and I welcome you all to partake in these difficult but necessary conversations with us. May the beginning of your year be encouraging and motivating, and we are happy and excited to have you here.
All right, so we're going to now transition to our breakout sessions and give you a chance to stand up and stretch a little bit. I want to say first, though, thank you to Dean Pettigrew, Associate Dean Wattenberg, and Associate Director Gail Smaller Jr. for providing a strong foundation to SPH and your educational experience. So there are going to be 2 breakout sessions coming up here. These sessions are going to provide you a chance to get up and moving, like I said, meet some other new students that you're not sitting at a table with, and learn about the resources that are available to you to support you this year. You're going to have the opportunity to go to both sessions, and so don't worry about missing one or the other. So first, raise your hand if you're an MHA or an MPH student. All right, the majority of you. You're going to be staying here in this room first, along with our online participants. And now raise your hand if you're an MS or a PhD student. Awesome. You're going to be going to that SPHOrientation room, which is the room right there behind the food and the AV table. That's going to be where you're going to go first. Let's see. The sessions will start, let's see, we're a little bit around, we'll say 10:33. How's that? We'll give you about 10 minutes to, or maybe 7 or 8 minutes to take a little break and get over and moving. And so take the few minutes to move to your assigned location, and we'll get going shortly after 10:30. Thank you so much. This is a clicker if you want to do your own clicker, but they can also do it for you if you want.
Oh.
But you don't really have a